Jennifer Song, and I will be presenting on the evaluation of the nutritional status of Korean elderlies with dementia in a long-term care facility in Yeonhee-dong, Seoul, South Korea. A little bit about me is that I was born in New York, but I currently live in Seoul, South Korea, and I'm a rising senior at Dwight School, Seoul. Some extracurriculars that I'm part of are research, volunteering, medical council, science honor society, and volleyball. I am interested in biochemistry and biomedical engineering, and I hope to pursue the career of a pediatrician. Another fun fact is that I was a participant in the Global Health Leaders Conference in 2022, and I was also a student speaker. To begin with, I'd like to talk about dementia and the dementia facilities that exist in Korea. So in 2023, there are more than 55 million people who were diagnosed with dementia, and this number is expected to reach 130 million by 2050. In 2008, the South Korean government implemented a long-term care (LTC) policy for elders with functional limitations. This policy led to an increase in residential facilities and 24-hour supervision care. Moving on, I'd like to mention how nutrition plays a role in dementia. Firstly, certain diets that are rich in fruits, vegetables, and whole grains and proteins have anti-inflammatory and antioxidant properties that can protect the brain from damage. Secondly, nutrition affects dementia indirectly by influencing cardiovascular health, as diets high in unhealthy fats, sugars, and processed foods can lead to conditions like diabetes, obesity, and heart disease, which are known as risk factors for dementia. Thirdly, certain nutrients have been studied for their potential neuroprotective effects, with omega-3 fatty acids found in fatty fish being essential for brain health. Therefore, there are various nutrition-specific benefits and the linkages between food and dementia. So the study that I conducted evaluates the nutritional levels of 30 patients who are all over the age of 65 with dementia, who are residents at the dementia facility in Yeonhee-dong. The aim of this study was to overall improve the meal quality in these facilities, starting with the one in Yeonhee-dong. The implications of the study on global health is that it essentially highlights the prevalence of malnutrition among elderly dementia patients, a concern likely present in other countries in addition to Korea, which emphasizes the need for global attention to improve the health outcomes. The findings of my study can also inform international policies and care practices by promoting a tailored nutritional intervention in a long-term care setting. And the study encourages collaboration in research and the sharing of best practices all over the world to address the various nutritional challenges faced by the patients, ultimately leading to a better healthcare facility worldwide. The methodology that I used to conduct my study was: first, I collected general data, for example, sex, age, height, weight, cognitive function score, and the duration of residence in the facility. This was followed up by a questionnaire that assessed dietary patterns for each patient. Secondly, the blood pressure and glucose measurements were conducted, and blood pressure monitors and self-monitoring glucose meters were implemented when monitoring the glucose levels before and after each meal intake. Lastly, the dietary assessment was conducted for 3 days for each patient, and this was done through pictures from nurses and caretakers. For the dietary assessment, the food group intake and the amount of energy and nutrients were calculated for each subject using the CAN Pro 5.0, and based on this data, the average daily food intake was calculated and compared with dietary reference intakes for Koreans to assess the nutritional status of each subject. So there are 3 meal types that I designed for this study. First is the general diet, which follows the meal plan of the dementia facility, and the soft diet consists of porridge with a side of kimchi. Thirdly, there's a puree diet, which consists of completely grounded and mixed down ingredients. 3 diets were designed to meet the needs of each patient's chewing ability. In order to process the data, I first calculated the nutrient density by standardizing the nutrient intake per 1,000 calories. Then the nutritional adequacy was assessed using the nutritional adequacy ratio and the mean adequacy ratio. And a scale point of 1.0 was considered adequate. There were 12 different key nutrients analyzed, and the index of nutritional quality was also calculated. The dietary diversity was then measured using the dietary diversity score, and there was a range from 0 to 5 based on the 5 major food groups. Now, this is a graph that shows the percentage of Korean dietary reference intakes according to the meal types. In general, there are 3 trends that can be seen. Number 1, general meals overall have higher percentages of the KDRIs compared to soft and puree meals, particularly in nutrients like energy, vitamin A, and phosphorus. Secondly, soft meals often have moderate percentages, oftentimes higher than puree meals, such as protein and thiamine. Thirdly, puree meals tend to have lower percentages of KDRIs compared to general and soft meals, except in some cases where vitamin A in puree meals have the highest percentage. Now to share the results of the study. The average daily intake of dementia patients in the LTC facility at Yeongyudong were significantly lower than the recommended levels, and those on soft and puree diets were particularly at risk of inadequate nutritional intake. Their chewing ability was a factor that significantly influenced their food intake ability, and over 83.6% of the patients did not complete their meals. And this resulted in significant deficiencies found especially in vitamin B6 and folic acid. To conclude the study, the meal quality and diversity must be improved for patients with dementia in the facility. There must be a variety of strategies that must be implemented to increase nutritional intake for patients with chewing difficulties. Some suggestions for improvements in nutritional health for patients with dementia are providing more vitamin-filled snacks instead of commercialized sweet treats, or developing a nutrient-rich food that are soft, such as porridges or soups. For acknowledgements, I would like to thank the patients, nurses, and the caretakers at the Yeongyudong Dementia Daycare Center, as well as Columbia's Accomplished Community Health Workers Program, and Dr. Kim for being a mentor and supporter throughout this research process. Lastly, I would like to thank my family, my mom, my dad, and my sister for their unwavering support. Here are the list of references, and thank you for listening to my presentation.